Lieutenant Sarah Martinez had always known she was different from other nurses. While her classmates in nursing school talked about working in quiet hospital wards or comfortable clinics, Sarah dreamed of something bigger. She wanted to serve where it mattered most, where her skills could save lives in the most dangerous places on Earth. Growing up in a military family in San Antonio, Texas, Sarah watched her father return from multiple deployments overseas. Captain Robert Martinez never talked much about what he saw in combat, but Sarah noticed how he would sometimes stare out the window with distant eyes. She saw the small scars on his hands, and the way he would unconsciously check exits when entering any room. Most of all, she remembered the night he came home and quietly told her mother about losing 3 good soldiers because medical help couldn't reach them in time. That conversation, overheard from the top of the stairs when she was just 14 years old, planted a seed in Sarah's mind. She decided that night that she would become the medical help that could reach soldiers when no one else could. She would learn to run toward danger instead of away from it. After graduating from nursing school with top honors, Sarah immediately enlisted in the Army. Her nursing background fast-tracked her into advanced medical training, but she wanted more. She volunteered for every additional course available. She learned advanced trauma surgery techniques, battlefield triage protocols, and emergency medicine procedures that most nurses never encounter in their entire careers. Sarah's commanding officers noticed her drive immediately. She was the first to volunteer for difficult assignments and the last to leave when there was still work to be done. During training exercises, she would carry wounded soldiers twice her weight across rough terrain without complaint. Her fellow medics started calling her Iron Sarah because nothing seemed to break her determination. When the opportunity came to train for the Combat Medic Badge, Sarah jumped at the chance. The Combat Medic Badge was one of the most respected achievements in military medicine. It required not just medical knowledge, but the physical and mental toughness to perform under extreme pressure. Most candidates were seasoned combat medics, with years of field experience. Sarah would be the first nurse to attempt the certification at Fort Bragg. The training location was announced just 2 weeks before the assessment. Naval Special Warfare Command. Sarah would be testing alongside Navy SEALs who were cross-training in advanced medical techniques. When she heard the news, Sarah felt a mixture of excitement and nervousness. SEALs were legendary for their toughness and their skepticism toward outsiders. As a nurse, and as a woman, Sarah knew she would face double the scrutiny. The night before leaving for the assessment, Sarah called her father. "Dad, I'm nervous," she admitted. Something she rarely did. These SEALs have seen real combat. They've saved lives under fire. What if they don't think I belong there? There's one and there speak SEALs of the times. There's one of this feeling the side. On the times. There's one of the work. There's one of the side. There's one of the times. Captain Martinez was quiet for a long moment. "Sarah, I've seen a lot of brave people in my career, but I've never seen anyone with your heart for helping others. Those SEALs might have more experience, but they don't have your passion. Trust your training, trust yourself, and show them what a Martinez can do." Sarah arrived at the Naval Special Warfare Facility in Coronado, California, on a foggy Monday morning. The base was intimidating, with its stark concrete buildings and the sound of helicopters constantly overhead. She carried her medical kit and a small duffel bag, looking around at the other candidates who were already gathering in the parking area. There were 12 candidates total, and Sarah was the only woman. The men were all tall, muscular, and moved with the confident swagger that came from years of special operations training. They wore their experience like armor, talking in low voices about previous deployments and missions. Sarah could hear fragments of their conversations, stories about firefights in Afghanistan, rescue missions in Iraq, and medical emergencies in places she had only read about. As she approached the group, the conversations gradually stopped. 12 pairs of eyes turned to look at her, taking in her smaller frame and the nursing insignia on her uniform. Sarah could practically hear their thoughts. "What is a nurse doing here? This is going to be a long day for her." "You sure you're in the right place, miss?" asked a tall SEAL with a thick Boston accent. His name tag read Kowalski. and he had the weathered look of someone who had seen multiple combat deployments. The medical conference for base personnel is probably in the other building. Sarah looked him directly in the eye. I'm here for the combat medic badge assessment, same as you. Another SEAL, shorter but built like a linebacker, laughed. No offense, but this isn't exactly a nursing school practical exam. We're talking about battlefield medicine here. Real combat situations. I understand that, Sarah replied calmly. I'm ready. The third SEAL, who had been quiet until now, stepped forward. His name tag read Thompson, and he had the kind of intense stare that made people uncomfortable. Look, I'm sure you're a great nurse. My mom's a nurse, and I respect what you do. But this is different. When bullets are flying and your buddy is bleeding out, you don't have time to be gentle. You don't have time to think about patient comfort. Sometimes you have to hurt people to save them. Are you ready for that? Sarah had encountered this attitude before during her military training. She understood it, even respected it to some degree. These men had earned their skepticism through hard experience. They had seen people freeze under pressure, had watched good people crack when the stakes were highest. They weren't being mean. They were protecting their brotherhood from someone they saw as unproven. I know you don't know me, Sarah said, addressing all of them. I know you have every reason to doubt whether I belong here, but I didn't come this far to prove something to myself. I came because soldiers like you deserve the best medical care possible. Whether it comes from a SEAL medic or a nurse, if I can't cut it, I'll wash out just like anyone else. But I'm asking you to give me the chance to show you what I can do. The SEALs exchanged glances. There was something about her calm confidence that made them pause. She wasn't backing down, but she wasn't getting defensive either. She was stating facts. Kowalski shrugged. Fair enough. But when this gets tough, and it will get tough, don't expect us to go easy on you because you're a nurse or because you're a woman. We're all here to earn the same badge. I wouldn't want it any other way, Sarah replied. Just then, a voice boomed across the parking area. Candidates, form up. The group quickly arranged themselves into a line as a senior chief petty officer approached. He was a compact man with gray hair and the kind of presence that commanded immediate attention. His uniform was covered with ribbons and badges that told the story of a long and distinguished career in special operations. I'm Senior Chief Morrison, he announced. I'll be your primary instructor for this assessment. I've been a SEAL for 22 years, and I've been training combat medics for the last 8. I don't care what your background is, what your rank is, or what's between your legs. I only care about one thing. Can you save lives under pressure? He began walking down the line, looking each candidate in the eye. This badge isn't handed out for participation. It's earned through demonstrated competence under stress. Over the next 3 days, you'll face scenarios designed to push you beyond your comfort zone. You'll treat wounds while under simulated fire. You'll make life or death decisions with incomplete information. You'll carry wounded soldiers across terrain that would challenge a marathon runner. When he reached Sarah, Senior Chief Morrison paused. You're the nurse. Yes, Senior Chief. I've read your file. Impressive academic record. Excellent performance in basic combat training. But this isn't about what you've done in training. This is about what you can do when everything goes wrong. Are you ready for that? Yes, Senior Chief. He studied her for a moment longer, then continued down the line. When he reached the end, he turned back to address the group. Your first assessment begins in 1 hour. Report to Building 127 inches full combat gear. Bring your medical kits and prepare for a long day. Some of you will be going home tomorrow. The question is, who wants this badge badly enough to earn it? As the group dispersed to gather their gear, Sarah heard one of the SEALs behind her whisper to another, $20 says the nurse is gone by lunch. Sarah didn't turn around, but she smiled to herself. She had been underestimated before. It never lasted long. Building 127 looked like a warehouse from the outside, but inside it had been transformed into a medical training facility unlike anything Sarah had ever seen. The space was divided into multiple scenario areas, each designed to simulate different combat environments. One corner had been set up to look like the interior of a damaged helicopter. Another area resembled a bombed-out building with rubble and debris scattered around makeshift casualties. A third zone was designed to simulate a forward operating base under attack, complete with sound effects of gunfire and explosions. Senior Chief Morrison stood in the center of the space with several assistant instructors, all of whom looked like they had stepped out of a special operations recruiting poster. They wore the quiet confidence of men who had seen real combat and lived to teach others what they had learned. "Your first scenario is medical triage under fire," Morrison announced to the 13 candidates. Sarah noticed that somehow their group had grown by one. Apparently another SEAL had joined them at the last minute. "You'll be presented with multiple casualties in a simulated combat environment. Your job is to assess, prioritize, and treat them according to tactical field care protocols. The scenario will last 30 minutes. Time starts now." Immediately, speakers around the room erupted with the sound of gunfire, explosions, and shouting voices. Sarah's heart rate spiked, but she forced herself to focus on the task ahead. The first rule of combat medicine was simple. You can't help anyone if you get yourself killed. She needed to stay calm and think clearly. The first casualty was a mannequin dressed in military fatigues, positioned near the entrance to the simulated building. There was fake blood everywhere, and the mannequin had been rigged with what appeared to be a severe leg injury. Sarah dropped to her knees beside it, her hands moving automatically through the assessment procedure she had practiced hundreds of times. "Massive hemorrhage? Femoral artery involvement," she called out, loud enough for the instructors to hear over the simulated gunfire. She applied a tourniquet with swift, confident movements, then moved to check for other injuries. The mannequin had been rigged with multiple trauma points, designed to test whether candidates could find and prioritize all injuries quickly. Around her, the other candidates were working on their own casualties. Sarah could hear Kowalski a few feet away, cursing as he struggled with a particularly complex chest trauma scenario. Thompson was working on what appeared to be a head injury, his movements quick and precise. The second casualty was harder to reach. Sarah had to low crawl across 20 feet of open ground, while speakers blared the sound of machine gun fire overhead. The psychological pressure was intense, even though she knew it was just training. Her body wanted to freeze, to find cover, and wait for the shooting to stop. But she forced herself to keep moving, remembering her father's words about soldiers who died because medical help couldn't reach them. This casualty was more complex. Multiple shrapnel wounds, possible internal bleeding, and signs of shock. Sarah's hands moved quickly as she established an airway, checked for chest injuries, and started an IV line. The mannequin had been programmed to simulate vital signs, and Sarah could see the numbers dropping on the small monitor attached to its arm. "I need to get this casualty to cover for more extensive treatment," she called out to the nearest instructor. The man nodded and gestured toward a designated treatment area behind some concrete barriers. Sarah grabbed the mannequin under the arms and began dragging it toward safety. The thing weighed at least as much as a real person, and the combination of adrenaline and physical exertion was making her heart pound. But she had trained for this, spending countless hours in the gym building the strength to move wounded soldiers. As she reached the treatment area, Sarah heard a commotion from across the room. One of the newer SEALs was struggling with his casualty, clearly overwhelmed by the noise and pressure. He had frozen up, staring at the mannequin without taking action. Senior Chief Morrison appeared beside him like a ghost. "Medic!" Morrison shouted. "Your patient is dying. What are you going to do about it?" The SEAL snapped out of his freeze and began working, but Sarah could see that he was rattled. It was a good reminder that even experienced special operations personnel could be affected by stress. The key was training your body and mind to function automatically under pressure. Sarah's third casualty was the most challenging yet. An unconscious patient with what appeared to be a traumatic brain injury. The mannequin's eyes were rolled back, and it had been programmed to simulate irregular breathing. Brain injuries were among the most difficult to treat in combat situations because they required delicate care that was hard to provide under fire. She established an airway and checked the patient's neurological responses according to the Glasgow Coma Scale. The numbers weren't good. In a hospital setting, this patient would need immediate surgery and intensive monitoring. In a combat setting, Sarah had to make the difficult decision about how much time and resources to invest in someone who might not survive anyway. It was a horrible calculus that every combat medic learned. Sometimes you had to let one person die to save 3 others. The thought of making that choice in real life made Sarah's stomach clench. But she pushed the emotion aside and focused on the medical facts. Severe TBI, Glasgow Coma Scale of 4, she reported to an instructor. Airway secured, breathing assisted. But prognosis is poor. Recommend evacuation to surgical facility immediately if available. Otherwise, classify as expectant. The instructor nodded grimly. Expectant was the medical term for casualties who were expected to die despite treatment. It was a classification that every combat medic dreaded, but sometimes had to use. Around the room, the other candidates were reaching similar conclusions about their own casualties. Sarah could hear Thompson arguing with an instructor about treatment priorities, his voice rising with frustration. The stress was getting to everyone, but that was the point. Combat medicine wasn't about having perfect conditions and unlimited time. It was about making the best decisions possible with incomplete information under extreme pressure. The sound effects suddenly stopped, and Senior Chief Morrison's voice cut through the silence. Time. Step away from your casualties and gather in the center of the room. Sarah stood up, her hands covered in fake blood and her uniform soaked with sweat. She had worked on 6 different casualties during the 30-minute scenario, ranging from simple gunshot wounds to complex multi-trauma cases. Her body ached from crawling, lifting, and dragging, but she felt energized by the challenge. The candidates formed a circle around Morrison, who began his debrief immediately. This scenario is designed to test your ability to function under stress while making critical medical decisions. Some of you did well. Others need improvement. He pointed to the SEAL who had frozen earlier. Rodriguez, what happened with your first casualty? Rodriguez looked uncomfortable. I got overwhelmed by the noise. Senior Chief lost focus for a moment. In combat, that moment of lost focus gets people killed. You need to train your mind to function automatically under stress. If you can't handle simulated gunfire in a training facility, how are you going to handle real bullets? Morrison moved on to Thompson. You spent 8 minutes arguing with my instructor about whether to treat the chest wound or the leg wound first. In those 8 minutes, your patient bled to death. What's the lesson? Trust the training and make decisions quickly, Thompson replied. Exactly. Perfect decisions made too late are worthless. Sometimes a quick, good decision is better than a slow, perfect decision. Finally, Morrison turned to Sarah. Martinez, you handled 6 casualties in 30 minutes and made appropriate triage decisions for all of them. Your technique was solid, and you maintained focus under pressure. Well done. Sarah felt a surge of pride, but she tried not to let it show on her face. Around her, she could see some of the SEALs looking at her with new respect, but she also noticed that a few of them looked annoyed, as if her success somehow diminished their own performance. Kowalski stepped forward. Senior Chief, with all due respect, Martinez had some of the easier casualties. Rodriguez and I got stuck with the complex multi-trauma cases. Morrison's expression didn't change, but Sarah could sense his annoyance. Are you suggesting that I deliberately gave certain candidates easier assignments? Not exactly, but because if that's what you're suggesting, you're questioning my integrity as an instructor. And I can tell you right now that questioning my integrity is a fast way to find yourself on a bus back to your unit. Kowalski backed down quickly. No, Senior Chief, I'm not questioning your integrity. Good. Because the casualty assignments were randomly distributed. Martinez handled 6 casualties because she worked efficiently and didn't waste time. You handled 3 because you spent too much time on each one. The lesson here is that combat medicine is about speed and efficiency as much as it is about medical knowledge. Sarah could feel the tension in the room increasing. She understood Kowalski's frustration. Nobody liked being shown up, especially by someone they saw as an outsider. But she also knew that this was just the beginning. If the SEALs were frustrated with her performance now, It was only going to get worse as the assessment continued. Morrison clapped his hands together. All right, enough discussion. You have 15 minutes to clean up and hydrate. Next scenario starts at 1,400 hours. This time we're going to test your ability to perform emergency surgery under fire. As the group dispersed, Sarah overheard Thompson talking quietly to two other SEALs. She's good, I'll give her that. But wait until we get to the physical challenges. That's where we'll see what she's really made of. Sarah pretended not to hear, but she made a mental note. The SEALs were already planning for her to fail on the physical portions of the assessment. She would have to be ready to prove them wrong again. The emergency surgery scenario took place in a different section of Building 127, designed to simulate a field hospital that had come under attack. The lighting was dim and flickering, simulating damaged electrical systems. The air was thick with artificial smoke that made Sarah's eyes water and her throat burn. Speakers around the room played the sound of artillery shells falling nearby, each explosion making the ground shake beneath their feet. Senior Chief Morrison gathered the candidates around a surgical table, where a mannequin lay with what appeared to be a severe abdominal wound. Your patient has taken shrapnel to the abdomen and is bleeding internally. You need to perform emergency surgery to save his life. The catch: you're in a field hospital that's under attack. The enemy knows where you are, and they're trying to take out your medical facility. Thanks for watching. I'm Seanan. The catch: they're working your reasons all. I made for you do are. The catch: they're working that a one. The catch: they're working that a catch they working that. He gestured to the flickering lights and smoke-filled air. Your power is unreliable, your visibility is poor, and you could be hit by artillery at any moment. You need to work fast, but you also need to work accurately. One wrong move, and your patient dies. Sarah stepped up to the table with the other candidates. Each would take a turn performing the same procedure, while the others watched and learned from their mistakes. It was a cruel but effective teaching method. Not only did you have to perform under pressure, but you had to do it while knowing that your peers were judging your every move. Thompson volunteered to go first. He was a confident surgeon under normal conditions, but the combination of smoke, noise, and flickering lights clearly threw him off his game. Sarah watched as he struggled to maintain visibility of the surgical site, while explosions shook the building around them. "Clamp!" Thompson called out, but his hands were shaking slightly. The artificial blood kept obscuring his view, and he had to keep stopping to clear the surgical field. What should have been a 15-minute procedure stretched to 25 minutes. Time of death: 2,130 hours, announced one of the instructors. Your patient bled out because you couldn't work quickly enough under adverse conditions. Thompson stepped back from the table, frustration written all over his face. He was an excellent medic under normal conditions, but the stress scenario had gotten to him. Kowalski went next and performed better, completing the procedure in 19 minutes. But he made a critical error in suture technique that would have led to infection in a real patient. Rodriguez managed to save his patient but took 22 minutes and used twice the normal amount of surgical supplies. Finally, it was Sarah's turn. She approached the table and took a moment to survey the scene. The key to working in adverse conditions was to adapt your technique rather than fight against the environment. Instead of trying to ignore the flickering lights, she positioned herself to make the best use of the available illumination. Instead of fighting the smoke, she worked in short bursts and took breaks to clear her vision. "Scalpel," she said calmly, and began her initial incision. The mannequin had been rigged with realistic internal organs and flowing artificial blood. Sarah's hands moved with steady precision as she opened the abdomen and began searching for the source of the bleeding. Around her, the speakers continued to blast the sound of artillery and small arms fire. Every few minutes, the lights would flicker off completely for several seconds before coming back on. But Sarah had trained for this kind of scenario during her military medical training. She knew how to work by feel when visibility was poor. "Found it," she announced after just 3 minutes of searching. Lacerated spleen. Major arterial involvement. Beginning repair now. The spleen repair was one of the most technically challenging procedures a combat medic could perform. It required delicate work with fragile tissue, while controlling massive bleeding. In a real combat situation, Many medics would simply remove the spleen entirely to save time. But the assessment required candidates to attempt the more difficult repair procedure. Sarah's nursing background actually gave her an advantage here. She had assisted in hundreds of surgical procedures during her training, and her hands were steady from years of precise medical work. While the SEALs were excellent at combat medicine and trauma care, they had less experience with delicate surgical procedures. She worked quickly but carefully, using a technique she had learned from an army surgeon during advanced training. Instead of trying to see everything clearly, she relied on her sense of touch to guide her hands, while using brief moments of good visibility to confirm her progress. "Bleeding controlled," she announced after 8 minutes. "Beginning closure now." The suturing went quickly. Sarah used a continuous stitch technique that was both fast and secure, perfect for combat conditions where you needed to close quickly, but couldn't afford to have the wound reopen later. Around her, she could hear the other candidates muttering to each other, clearly impressed despite themselves. "Procedure complete," Sarah announced, stepping back from the table. "Total time, 13 minutes. Senior Chief Morrison checked his watch and nodded. 13 minutes, 2 seconds. Well within acceptable parameters. Patient would survive for evacuation to higher-level care. As Sarah cleaned her hands, she noticed the reactions of her fellow candidates. Some looked impressed, others looked annoyed. Thompson was shaking his head in disbelief. "How did you work so fast in those conditions?" Rodriguez asked. "I could barely see what I was doing." "You adapt your technique to the environment instead of fighting against it," Sarah replied. "In nursing school, we had to practice procedures in all kinds of conditions. Sometimes the power goes out. Sometimes there's chaos around you. Sometimes the patient is combative. You learn to focus on what you can control and work around what you can't." Kowalski stepped forward, his expression skeptical. "That's great in theory, but nursing school isn't combat. When people are shooting at you for real, it's different. The stress is different." "You're absolutely right," Sarah agreed. "I've never been shot at. But I have worked in trauma situations where people were dying, and every second counted. I've worked in emergency rooms during mass casualty events where the chaos was incredible. It's not the same as combat, but it's not that different either." Morrison clapped his hands for attention. "All right, enough discussion. Time for the physical assessment. Report to the obstacle course in 10 minutes. Full combat gear, medical packs, and prepare to carry casualties." As the group headed outside, Sarah could hear Thompson and Kowalski talking behind her. "She's been lucky so far," Thompson was saying. "The medical stuff plays to her strengths. But now we get to the real test. Let's see how the nurse handles carrying a 200-pound man across rough terrain while people are shooting at her." "I don't know," Kowalski replied, his voice thoughtful. "Did you see how calm she was during that surgery? I've been doing this for 8 years, and I was rattled by those conditions. She acted like it was just another day at the office. Surgery is one thing. Physical performance under stress is another. Trust me. She's about to find out what this badge is really about." Sarah smiled to herself as she checked her gear. The SEALs still saw her as primarily a nurse, someone whose skills were limited to medical procedures. They didn't understand that her nursing background had prepared her for exactly this kind of challenge. Emergency room nurses didn't just stand around looking pretty. They lifted patients, ran between rooms, worked 12-hour shifts on their feet, and dealt with life-or-death situations every single day. More importantly, they didn't understand how badly she wanted this. The Combat Medic badge wasn't just another qualification for Sarah. It was proof that she belonged in the most elite circles of military medicine. It was validation that a nurse could perform at the same level as special operations medics. It was a chance to honor her father's service and the memory of those soldiers who had died waiting for medical help that never came. The obstacle course stretched out ahead of them like a nightmare designed by someone who hated the human body. It included rope climbs, wall climbs, tire runs, low crawls under barbed wire, and water obstacles. But that wasn't the hard part. The hard part was that candidates had to complete the entire course while carrying full medical packs and then perform medical procedures on casualties positioned throughout the course. The scenario is a medical evacuation under fire, Morrison explained to the group. You'll encounter wounded soldiers at various points along the course. Your job is to reach them, provide emergency medical care, and evacuate them to safety. You'll be timed on both your physical performance and your medical competence. He pointed to a series of mannequins positioned at different points along the course. Some of these casualties can be stabilized and moved. Others are too severely wounded and will need extensive treatment in place. Your job is to make those decisions quickly and correctly while under fire. Sarah looked at the course with a mixture of excitement and nervousness. It was intimidating, but she had trained for this. During her military preparation, she had spent countless hours on similar obstacles, building her strength and endurance. She had practiced carrying wounded soldiers until she could do it without thinking, but she also knew that the SEALs were right about one thing. This was where her lack of combat experience would show most clearly. They had been through similar courses under real combat conditions. They knew exactly how to pace themselves, how to conserve energy for the medical procedures, and how to stay calm when their bodies were screaming for rest. "Martinez," Morrison called out. "You're up first." Sarah felt 13 pairs of eyes on her as she approached the starting line. This was it. The moment that would determine whether the SEALs accepted her as an equal or continued to see her as an outsider who had gotten lucky on the medical portions. The starting horn echoed across the training facility, and Sarah exploded forward like a sprinter leaving the blocks. The first obstacle was a 30-foot rope climb, and she attacked it with controlled aggression. Her hands found their rhythm on the rough manila rope, and her legs provided steady support as she climbed hand over hand toward the top. Behind her, she could hear the instructors starting up the speakers again. The sound of machine gun fire filled the air, along with the distant rumble of artillery. But Sarah had learned to tune out the noise during the earlier scenarios. Instead of fighting the psychological pressure, she used it to fuel her intensity. She reached the top of the rope in 45 seconds and rappelled down the back side. The first casualty was waiting at the bottom. A mannequin dressed in combat gear with what appeared to be a severe leg injury. Sarah dropped to her knees beside it and began her assessment. Compound fracture, right femur, with arterial involvement. She called out to the observing instructors. Her hands moved quickly as she applied a tourniquet and splinted the leg. The mannequin was rigged with a weight system that made it feel like a real person, and Sarah knew she would have to carry it to the designated casualty collection point, 50 meters away. She grabbed the mannequin in a fireman's carry and started jogging toward the collection point. The weight was substantial, probably close to 200 pounds. But Sarah had trained for this. During her preparation, she had spent hours carrying weighted dummies around the base track, building the specific strength and endurance needed for casualty evacuation. The key was proper technique and pacing. Instead of trying to sprint with the weight, Sarah settled into a steady jog that she could maintain for long distances. Her breathing stayed controlled, and she could feel her heart rate settling into a sustainable rhythm. Behind her, she could hear the other candidates being released onto the course at 30-second intervals. Thompson was already on the rope climb, moving with the fluid efficiency of someone who had done this hundreds of times before. But Sarah didn't look back. She had learned long ago that you couldn't control what others did. You could only control your own performance. She reached the casualty collection point and gently placed the mannequin on the designated stretcher. An instructor checked his watch and made a note on his clipboard. Sarah couldn't see what he wrote, but his expression was neutral, which she took as a good sign. The next obstacle was a series of tire runs, followed by a low crawl under barbed wire. Sarah attacked the tires with short, quick steps, her feet finding the centers of each tire with practiced precision. The low crawl was harder. 30 meters of muddy ground with barbed wire strung just 18 inches above the surface. Sarah dropped to her belly and began moving forward using her elbows and knees. The artificial mud was cold and sticky, and she could feel it seeping through her uniform. The barbed wire caught at her pack several times, forcing her to stop and carefully extract herself before continuing. Halfway through the crawl, she encountered the second casualty. This one was positioned directly under the wire, simulating a soldier who had been wounded while trying to navigate the same obstacle. Sarah had to assess and treat the injury while lying on her stomach in the mud with barbed wire inches above her back. The mannequin had been rigged with a chest wound that was bleeding heavily. Sarah used her body to shield her medical kit from the mud as she pulled out the necessary supplies. Working in such a confined space was incredibly difficult, but she managed to seal the chest wound and establish an airway in less than 3 minutes. Pneumothorax, treated with chest seal, she reported. Patient stable for evacuation. This casualty was too heavy to carry while crawling, so Sarah had to drag it behind her as she completed the low crawl. The extra weight made the obstacle twice as hard, and by the time she emerged on the other side, her forearms were burning with fatigue, but there was no time to rest. The next obstacle was a wall climb. 12 feet of vertical wood that had to be scaled without ropes or assistance. Sarah approached it at a run, planted her left foot on the wall about 3 feet up, and used her momentum to grab the top edge with both hands. For a moment, she hung there, her body weight suspended entirely by her grip strength. This was where her months of preparation would pay off, or fail her completely. She had spent countless hours in the gym doing pull-ups, rope climbs, and grip strength exercises, all preparing for moments like this. Sarah pulled herself up and over the wall in one smooth motion, dropping down to the other side and immediately starting toward the next obstacle. Behind her, she could hear Thompson completing the low crawl, cursing creatively as the barbed wire caught his pack. The water obstacle was brutal, a pool of cold water that candidates had to swim across while wearing full gear and carrying their medical packs. The water was probably 50 degrees, cold enough to take your breath away and make your muscles seize up. But Sarah had trained for this too, spending hours in cold water during her military preparation. She hit the water at a controlled dive and immediately felt the shock of the cold. Her body wanted to gasp and hyperventilate, but she forced herself to breathe slowly and steadily. The medical pack on her back felt like it weighed 100 pounds in the water, trying to drag her down to the bottom of the pool. Sarah used a modified breaststroke to cross the pool, keeping her head above water so she could maintain situational awareness. Halfway across, she encountered the third casualty, a mannequin floating in the middle of the pool with what appeared to be a head injury. Treating a casualty while treading water was incredibly challenging. Sarah had to maintain her position in the pool while assessing the injury and applying treatment. The mannequin kept trying to sink, and Sarah had to support its weight while working. Possible traumatic brain injury with loss of consciousness, she reported, her voice slightly strained from the effort of treading water. Airway secured. Key spine immobilized. Requires immediate evacuation. She grabbed the mannequin in a cross-chest carry and began swimming toward the edge of the pool. The combination of the cold water, the weight of her gear, and the added burden of the casualty was exhausting. But Sarah had trained for exhaustion. She had learned to function when her body wanted to quit, to push through the point where most people would give up. She reached the edge of the pool and hauled both herself and the mannequin out of the water. An instructor was waiting with a stopwatch and clipboard, his expression unreadable. Sarah wanted to ask about her time, but she knew better than to show weakness by appearing concerned about her performance. The final obstacle was a rope bridge, 2 ropes stretched between towers 20 feet above the ground. Candidates had to cross using only their hands and feet, with nothing but air beneath them. It was a test of upper body strength, balance, and mental toughness all rolled into one. Sarah approached the bridge methodically. The key was to distribute her weight evenly between her hands and feet, moving in a rhythm that conserved energy while maintaining momentum. She had practiced this obstacle dozens of times, but never when she was already exhausted from the previous challenges. Her wet uniform made everything harder. Her hands kept slipping on the rope, and the cold air was making her muscles cramp. But Sarah forced herself to focus on the basics. Grip with the hands, hook with the feet, move one limb at a time. Never stop moving forward. Halfway across the bridge, she encountered the final casualty. This one was the most challenging yet. A mannequin hanging upside down from the rope, simulating a soldier who had fallen during the crossing and was now trapped. Sarah had to somehow assess and treat the casualty while hanging from a rope 20 feet above the ground. The mannequin had been rigged with multiple injuries, forcing Sarah to make complex medical decisions while performing what was essentially an aerial rescue. She managed to right the mannequin and secure it to the rope system, then treated its injuries as best she could under the circumstances. Multiple trauma, possible spinal injury, she reported, her voice carrying clearly in the cold air. Stabilized for evacuation, but requires immediate surgical intervention. She secured the mannequin to her own harness system and began the process of getting both of them safely to the other side of the bridge. It was exhausting work, requiring her to essentially carry another person's weight while navigating a rope bridge. By the time Sarah reached the end of the course, her entire body was shaking with fatigue. She had been moving at maximum intensity for over an hour, dealing with multiple casualties while navigating increasingly difficult physical obstacles. But she had done it. She had completed every challenge and treated every casualty according to protocol. Senior Chief Morrison was waiting at the finish line with his clipboard and stopwatch. His expression was neutral as always, but Sarah thought she detected a hint of approval in his eyes. Time: 1 hour, 13 minutes, 47 seconds, he announced. All casualties treated appropriately. All obstacles completed successfully. Sarah tried not to show her relief, but inside she was celebrating. She had not only finished the course, but she had done it faster than she had hoped. More importantly, she had maintained her medical standards throughout the entire evolution. She hadn't cut corners or made mistakes because of fatigue. Behind her, she could hear Thompson approaching the final obstacle. He was moving well, but Sarah could see that he was struggling more than she had expected. The course was taking its toll on everyone, even the experienced SEALs. Kowalski appeared a few minutes later, his face red with exertion and his breathing labored. He completed the course successfully, but his time was slower than Sarah's. Rodriguez finished shortly after, followed by the other candidates at various intervals. As the group gathered around Morrison for the debrief, Sarah could see a fundamental shift in how the SEALs were looking at her. The skepticism and condescension were gone, replaced by something that looked like grudging respect. The average completion time for this course is 78 minutes, Morrison announced to the group. 3 of you finished faster than average: Martinez, Thompson, and Kowalski. He turned to look directly at Sarah. Martinez, your time of 73 minutes and 47 seconds is the second fastest completion we've recorded this year. More importantly, your medical performance remained consistent throughout the entire evolution. That's exactly what we're looking for in combat medics. Sarah felt a surge of pride, but she tried to keep it off her face. Around her, the SEALs were processing this information with various degrees of surprise and respect. Thompson stepped forward. Senior Chief, I have to say I'm impressed. I didn't think anyone could move that fast while maintaining medical standards. That was professional work. For the first time since the assessment began, Thompson was looking at Sarah as an equal rather than an outsider. It was a small victory, but an important one. The final day of assessment dawned gray and cold, with a Pacific fog rolling in from the ocean that reduced visibility to just a few hundred yards. Sarah had barely slept the night before, not from nervousness but from excitement. She was so close to earning the combat medic badge that she could almost feel the weight of it on her uniform. The remaining candidates gathered in Building 127 for the final briefing. Several SEALs had washed out during the previous day's physical assessment, unable to meet the time requirements or maintain medical standards under pressure. Now only 8 candidates remained, including Sarah, Thompson, Kowalski, and Rodriguez. Senior Chief Morrison stood before them with the same neutral expression he had maintained throughout the entire assessment. Today's final scenario will test everything you've learned over the past 3 days. You'll be conducting a medical evacuation mission in hostile territory. Your team has been tasked with reaching a downed pilot, providing emergency medical care, and evacuating him to safety. He gestured toward a large map displayed on the wall behind him. The crash site is 2 kilometers from your insertion point. You'll have to navigate rough terrain, avoid simulated enemy positions, and reach the pilot within 45 minutes. Once you've stabilized him, you'll have to carry him back to the evacuation zone. Sarah studied the map carefully. The route to the crash site included several challenging terrain features: a river crossing, steep hills, and areas of dense vegetation that would slow their movement. But the most difficult part would be the return trip, carrying an injured pilot across the same terrain, while potentially under enemy fire. The pilot has been unconscious for an unknown period and has multiple injuries, Morrison continued. Your medical assessment and treatment will determine whether he survives long enough to reach definitive care. This is not a drill where everyone automatically survives if you follow the right procedures. Make the wrong decisions, and your patient dies. He paused to let that sink in. You'll be working as a team for this mission. That means you need to coordinate your efforts, communicate effectively, and support each other under stress. Individual brilliance won't save you if you can't function as part of a unit. Sarah glanced around at her fellow candidates. Over the past 3 days, their initial skepticism toward her had evolved into something approaching respect. But she wondered how they would react to working as part of a team where she might have to take a leadership role based on her medical expertise. Thompson stepped forward. Senior Chief, who's the team leader for this mission? You'll figure that out among yourselves, Morrison replied. Real combat situations don't always come with clear command structures. Sometimes the person with the most relevant expertise needs to take charge, regardless of rank or background. An hour later, the 8 candidates found themselves at the insertion point, a clearing in the coastal hills about 2 kilometers from the simulated crash site. They were wearing full combat gear, carrying medical supplies, and equipped with radios for communication with the command post. Sarah checked her equipment one final time. Her medical kit contained everything she might need for emergency surgery, from scalpels and sutures to blood products and pain medication. She had also packed additional supplies specifically for treating potential pilot injuries: cervical collars, long spine boards, and specialized trauma equipment. All right, let's move out, Thompson said, automatically assuming the leadership role. Kowalski, you take point. Rodriguez, you're our navigator. Martinez, stay in the middle where we can protect you. Sarah bit back her first instinct, which was to object to being protected, like she couldn't take care of herself. Instead, she focused on the mission. Thompson, we should discuss medical priorities before we encounter the patient. Depending on his injuries, we might need to make some difficult decisions about treatment versus evacuation time. Good point, Thompson acknowledged. What are you thinking? If he has spinal injuries, we'll need to immobilize him completely before moving him. That could add 20 minutes to our timeline. If he has internal bleeding, we might need to perform emergency surgery in the field. We need to agree now on how we're going to balance medical care against evacuation speed. The team spent several minutes discussing various scenarios and establishing protocols for different types of injuries. Sarah was impressed by how seriously the SEALs took her medical expertise. They asked detailed questions and made sure they understood the medical implications of different courses of action. All right, let's move, Thompson said finally. Remember, we're in hostile territory. Stay alert and stay together. The team moved through the rough terrain with practiced efficiency. The SEALs were obviously comfortable operating in small units, communicating with hand signals, and maintaining proper spacing. Sarah had to work harder to keep up with their tactical movement techniques, but her physical conditioning from the previous days served her well. They reached the river crossing in 20 minutes and found it more challenging than expected. The water was waist-deep and moving fast, with a rocky bottom that made footing treacherous. Crossing with full gear and medical supplies required careful coordination to avoid losing equipment or personnel. Sarah helped secure the medical gear in waterproof bags before the crossing. If they lost their medical supplies, the entire mission would fail regardless of how well they performed tactically. The SEALs appreciated her attention to detail, and Thompson made sure to acknowledge her contribution. Good thinking, Martinez. We can't treat anyone without medical gear. The team crossed the river successfully and continued toward the crash site. The terrain became increasingly difficult, with steep hills and dense vegetation that forced them to move single file through narrow paths. Sarah could feel her heart rate climbing from the physical exertion, but she maintained her position in the formation and kept pace with the team. 30 minutes after insertion, they reached the crash site. The simulated aircraft wreckage was scattered across a small clearing, and they could see the pilot, an instructor wearing flight gear, lying motionless near what remained of the cockpit. "Martinez, you're up," Thompson said immediately. "We'll establish security while you assess the patient." Sarah dropped to her knees beside the pilot and began her assessment. He was unconscious but breathing, with obvious head trauma and what appeared to be a badly injured leg. But as she examined him more carefully, she discovered additional injuries that would complicate the evacuation. "He's got a compound fracture of the left tibia, possible head injury, and what feels like internal bleeding," she reported to the team. "The head injury is my biggest concern. His pupils are unequal, which suggests increased intracranial pressure." Thompson crawled over to her position. "What's the bottom line? Can we move him?" Sarah was quiet for a moment, weighing the medical factors against the tactical situation. "If we immobilize him properly and monitor his neurological status, we can move him. But we need to be prepared to stop and perform emergency procedures if his condition deteriorates." "How long do you need to stabilize him?" "Give me 15 minutes to get an IV started, immobilize the leg fracture, and set up neurological monitoring. Then we can move him." Sarah worked quickly but carefully, establishing intravenous access and administering pain medication and fluids. She splinted the leg fracture using materials from her medical kit, then secured the pilot to a long spine board to protect his cervical spine during movement. The most challenging part was monitoring his neurological status while preparing him for evacuation. Head injuries could deteriorate rapidly, and Sarah needed to establish baseline measurements that would help her detect changes during the movement. "Neurological exam shows possible traumatic brain injury with increased intracranial pressure," she reported. "Glasgow Coma Scale is currently 8. Pupils are unequal but reactive. We need to get him to neurosurgical care within the next hour." "Roger," Thompson replied. "Team, prepare for evacuation. We're going to carry him back to the LZ using the spine board." The return journey was grueling. Carrying an injured person across rough terrain required constant coordination between team members. They had to maintain the pilot's spinal alignment while navigating obstacles, river crossings, and steep terrain. Sarah rotated between carrying positions and monitoring the patient's condition. Halfway back to the landing zone, the pilot's condition began to deteriorate. His level of consciousness decreased, and Sarah could see signs that the pressure inside his skull was increasing. "We need to stop," Sarah called out. "His neurological status is deteriorating. I need to decompress his skull, or we're going to lose him." The team immediately found cover and established a defensive perimeter while Sarah prepared for emergency surgery. Performing neurosurgery in a field environment was incredibly risky, but the pilot would certainly die without intervention. Sarah used a specialized kit to drill a small hole in the pilot's skull, relieving the pressure that was building inside. It was a delicate procedure that required steady hands and precise technique, made more difficult by the stress of the tactical environment. "Pressure relieved," she announced after several tense minutes. "His neurological status is improving. We can continue the evacuation." The team resumed movement, but now they were working against time. The pilot needed definitive neurosurgical care, and every minute of delay increased his chances of permanent disability or death. They reached the evacuation zone with just 5 minutes to spare in their timeline. A simulated helicopter was waiting to transport the pilot to a trauma center, and Sarah quickly briefed the flight medic on the patient's condition and the treatment she had provided. "Traumatic brain injury with successful field decompression," she reported. "IV access established, pain controlled, spinal immobilization maintained throughout evacuation. Patient should be taken directly to neurosurgical OR." As the simulated helicopter departed with the pilot, Senior Chief Morrison approached the exhausted team. His expression was unreadable as always, but Sarah thought she detected a hint of approval. "Mission complete," he announced. "Patient evacuated within acceptable time frame with appropriate medical care provided throughout. Well done." The team gathered around Morrison for the final debrief. Sarah was exhausted, both physically and emotionally, but she felt a deep sense of accomplishment. They had successfully completed one of the most challenging medical scenarios possible, working as a coordinated team under extreme pressure. "Martinez," Morrison said, turning to face her directly. "Your performance during this assessment has been exceptional. You've demonstrated not only technical medical competence, but the ability to function under stress, work as part of a team, and make critical decisions under pressure." He reached into his pocket and pulled out a small box. "It gives me great pleasure to award you the Combat Medic Badge. You've earned it." Sarah felt a rush of emotions as Morrison pinned the badge to her uniform. Pride, accomplishment, and validation all mixed together as she realized she had achieved something that many people thought was impossible for a nurse. Around her, the SEALs began applauding. Thompson stepped forward and extended his hand. "Martinez, I owe you an apology," he said. "I didn't think a nurse belonged in this assessment. I was wrong. You've proven that excellence in medicine comes in many forms, and you've earned the right to wear that badge." Kowalski nodded in agreement. "You've changed how I think about military nurses. You're not just a nurse who earned a combat badge. You're a combat medic who happens to have started as a nurse." Sarah looked down at the combat medic badge on her uniform, then back at the SEALs who had become her teammates and colleagues. She thought about her father, about the soldiers who had died waiting for medical help, and about all the future patients she might be able to save because of the skills she had learned. "Thank you," she said simply. "This badge doesn't just represent what I've accomplished. It represents what we can accomplish when we work together, when we look past assumptions and focus on what really matters, taking care of people who need our help." Senior Chief Morrison smiled for the first time since the assessment began. "That's exactly what this badge is about, Martinez. Welcome to the Brotherhood of Combat Medics. You've earned your place here." As the team walked back toward the base, Sarah felt a profound sense of belonging. She was no longer the nurse who was trying to prove herself among the SEALs. She was a combat medic who happened to have started her career as a nurse, and that distinction, small as it might seem to others, meant everything to her.